Hey everyone, we've got another heart today. This is number 92 in our collection. Why don't we go ahead and start off with a quick teaser or preview of the main phenotypic feature of this heart. So we'll go ahead and open up the right atrium of the heart here. And immediately we can tell what's going on in this heart. There is an atrioventricular septal defect with a large atrial shunt and a ventricular level shunt as well. Here is the common atrioventricular junction with a common atrioventricular valve. Here's the superior bridging leaflet that has direct connections to the ventricular septum here, consistent with the Rastelli type A. Here's the right anterosuperior leaflet. Here is the right inferior leaflet. Here is the inferior bridging leaflet with connections directly to the ventricular septum here. So now that we've gotten that quick teaser or preview out of the way, why don't we see how this heart would have otherwise sat in the chest? The heart would have sat roughly in the chest like this, anterior surface towards the screen, posterior surface towards the turntable, head are superior here, legs are inferior here, left over here, right over here. Now with that, why don't we go ahead and start off as we usually do, which is by trying to identify at least externally what appears to be the right atrial appendage. And here we find an appendage that's triangular, pyramidal, or broad-based. So let's go ahead and open up the heart there. And when we do that, we do find that there's pectinate muscles that spill outside the confines of the appendage, consistent with the morphologic right atrium. And here we can see the superior caval vein entering into the roof of the right atrium. And then immediately we see that there's a large atrial level shunt, and that there in fact is an atrioventricular septal defect. And here is the atrial strand, and here is the area of where the oval fossa would have been. So an oval fossa defect, the atrial strand, and then the atrial component of the atrioventricular septal defect. Now, if we look a little posterior in this atrium, we should be able to find the mouth of the coronary sinus as well. And I thought I had found it earlier. But I guess I must have been mistaken. Here it is. Here's the mouth of the coronary sinus. And at this point, we would usually stop and talk about the triangle of Koch, which remember is bounded by the mouth of the coronary sinus, the tendon of Totaro, and then the septal leaflet of the tricuspid valve. Now, since there's a large atrioventricular level shunt here, the electrical conduction axis does not live where it usually does. And in fact, the AV node would live in the triangle of Thien-Anderson, which we'll cover a little bit later. But why don't we turn our attention now to the common atrioventricular junction, which is guarded by an atrioventricular valve with essentially 5 components. Now here is the left ventricle, and here is the right ventricle here, and here is the ventricular septum right here. So once again, ventricular septum, here's the left ventricle over here, and then here's the right ventricle over here. So here is the superior bridging leaflet, and you can see that this superior bridging leaflet has direct connections to the ventricular septum here. And here, once again, is the ventricular septum, superior bridging leaflet, and here are the direct attachments of the superior bridging leaflet to the ventricular septum, consistent with a Rastelli A classification. Here is the left ventricle. We know it's a morphologic left ventricle because it has fine crisscross trabeculations. And so here is the left mural leaflet. Now when we turn our attention to the right-sided components of this atrioventricular valve, once again, here's the superior bridging leaflet. And then here, in fact, is the right anterosuperior leaflet. And then here is the right inferior leaflet. And then here when we look down at this ventricular septum here, here in fact is the inferior bridging leaflet, which also has direct connections to the ventricular septum. So here nicely you can see the 5 components, or the 5 leaflets of the common atrioventricular valve. Left mural leaflet, superior bridging leaflet, right anterosuperior leaflet, right inferior leaflet, and the inferior bridging leaflet. Let's take a look at this ventricle here, which has coarse trabeculations and does appear to have a septomarginal trabeculation consistent with a morphologic right atrium. And here we can see the superior bridging leaflet here, and we can also see the ventricular level shunt that also exists in this heart. So this is an atrioventricular septal defect, Rastelli A, that has both an atrial and ventricular level shunt. Here, in fact, is the pulmonary outflow tract. We come across an arterial valve that has 3 leaflets, 1, 2, 3, and 3 sinuses, 1, 2, 3. No coronary arteries arising from any of these sinuses, all consistent with the morphologic pulmonary valve. Note that the pulmonary valve is entirely supported by muscle. And note that there really isn't any true round or oval shaped annulus. This valvar structure here is actually crown shaped. And you can see that the half circle or semilunar arterial valve leaflets actually have these interleaflet triangles that are interposed between the valve leaflets, creating almost a crown shape. Here's the pulmonary trunk, and that gives rise to the branch pulmonary arteries. Here's the posterior aspect of this heart. Here's the left atrial appendage. And you can see that all the pectinate muscles are confined within this left atrial appendage here. So here is now the left atrium. We can once again appreciate now from the left side the large atrial shunt in the setting of this atrioventricular septal defect. Here we find a ventricle that has fine crisscross trabeculations, consistent with the morphologic left ventricle. And here is the other side of the ventricular wall here. Here we see the superior bridging leaflet coursing through the atrioventricular septal defect. And we know that this has direct connections to the ventricular septum, as we've seen before, once again making this a Rastelli A. You can note that there's this scooped out appearance of the ventricular septum, which is often seen in the setting of atrioventricular septal defect. And here's the left ventricular outflow tract. And you can see that there is a discrepancy between the inlet portion of this left ventricle and the outlet portion of this left ventricle, with the outlet being significantly larger, or longer, I should say, than the inlet. And that's because the aortic valve in the setting of AVSD is sprung forward. It is no longer wedged in between 2 separate atrioventricular valves because there is only a single common AV valve. So the aorta cannot be wedged in between it, and in fact is sprung forward. This also leads to the so-called gooseneck deformity that can also be appreciated by echocardiography. A little bit of endocardial fibroelastosis here. And then here we come across another arterial valve, also with 3 leaflets, 1, 2, 3, and 3 sinuses. It's hard to really see, but there is a coronary that we can see arising from here, consistent with an aortic valve. And there is fibrous continuity between the aortic valve and this superior bridging leaflet here. And then here is the ascending aorta. The transverse aorta is here, and the descending aorta has been transected. So a heart with an atrioventricular septal defect, with both an atrial and a ventricular level shunt. Here is the crest of the ventricular septum. Here's the superior bridging leaflet with connections directly to the crest of the ventricular septum, making this a Rastelli classification A. Here is the left mural leaflet. Here again is the right anterosuperior leaflet. Here is the right inferior leaflet, and here is the inferior bridging leaflet.